Well, earlier this year, we brought you the story about mercury dental fillings and whether they were toxic for your health.
After our story aired, a number of people came forward saying they're convinced their health problems started from their mercury fillings and unsafe removal of those fillings. So we are taking action to see if there's any truth to that claim in tonight's special report, Toxic Teeth.
Freya Koss was a successful, active businesswoman. She played tennis and even took ballet into her mid-50s. One night, she was hit with severe physical symptoms out of nowhere.
I had double vision, drooping eyelids, loss of equilibrium, loss of muscle strength.
You can see how dramatic the physical changes were.
I went to a neurologist at a teaching hospital and I was diagnosed with 3 life-threatening autoimmune diseases.
She immediately hit the internet looking for answers, remembering that she'd had dental work done just 7 days before her symptoms started, with 1 mercury filling placed and 1 removed. She says she discovered that she'd been mercury poisoned.
I was shocked. I was angry. I thought my life was over.
You doing okay?
Dr. Ada Frazier isn't surprised. She's an integrative holistic dentist and says the biggest risk to a patient is when you take out dental amalgams, also known as silver or mercury fillings. That's because of the mercury vapors released.
It is a toxic substance. It's a neurotoxin. And so we are trained to follow a specific protocol that keeps both the patient and the practitioner and their staff safe from any exposure.
That protocol also protects the environment.
One of the things that we use is a mercury ionizer, and it emits a stream of electrons across the patient's head as we're cutting the amalgam out.
The patients breathe in pure oxygen. Dr. Frazier and her assistants wear this mask where the canisters protect them from breathing in any vapors. There are HEPA filtration systems all over the building. Frazier says mercury toxicity has been linked to everything from Alzheimer's and Parkinson's disease to MS and depression.
It can completely shut down your immune system.
According to the American Dental Association, dental amalgam is considered a safe, affordable, and durable material. The U.S. Food and Drug Administration also considers them safe, but admits that high levels of mercury vapor exposure are associated with adverse effects in the brain and the kidneys. But Freya Koss doesn't buy it and says there's nothing safe about these fillings. After a 16-year battle to regain her health, she says something needs to change and has dedicated her life to getting the word out and trying to change public policy.
I regained my equilibrium within several weeks of having the fillings removed, and I started to heal.
In October, nearly 100 countries gathered in Japan to sign a treaty to reduce the use of mercury globally. The United States wasn't there because of the government shutdown, but the U.S. did sign and ratify the treaty in early November. Some countries, like Sweden and Norway, have banned the use of dental amalgams. And for patients like Freya, they can only hope the rest of the world is not far behind.